Well, my name is Dr. Ronald Morton. I am the president and founder of the East Texas Sinus and Dizziness Center. I became an otolaryngologist or ear, nose, and throat specialist for a few reasons. One, I knew I wanted to be a surgeon, but I wanted a quality of life at home with my wife and my family. But I knew I wanted to be in some sort of surgical specialty. So I went into that when I met Dr. Byron Bailey and the folks I trained with down in Galveston. The residents there had a great quality of life, and I wanted to do that. So it led me into that surgical specialty, which covered a whole lot of different niches, from pediatrics to rhinology, throat, all the other things you can do there, and that's the direction I wanted to go with my practice. During my time as an otolaryngologist, there have been a lot of treatment advances in many different fields, but no more so than the treatment of sinus disease. And we were really fortunate enough to get in kind of early on with some people that had done lots of work in the field of sinusitis and allergic treatment and eustachian tube management from back about 10, 12 years ago. And we jumped in about 9, 10 years ago. And the advancements are in the field of treatment of sinus infections, both medically and procedurally oriented. And the advancements, especially since 2012, with the advent of minimally invasive technology, that you can do a procedure in the office just as if you were going to go to the hospital, and have these folks have outcomes that are the same as more invasive procedures. These procedures we were able now to do with the techniques that we've perfected to do the same type of procedure in less than an hour in the office, and these folks are back to work in 24 to 48 hours. When I treat patients with sinus problems, my favorite part is the follow-up I get after I am doing these procedures, especially the ones that have had previous FEST procedures like I've had. They will come back in, and not only the ability to give them the cutting edge therapy that very few people around here can do, and the feedback that we get reinforces the fact that we're really heading the right direction with our practice. So it's a lot of fun to be able to offer this type of stuff, not only to my patients, but we teach patients from around the country. They fly into the office. We go over these techniques with them, from anesthesia to the technique to follow up, and it's just a very gratifying part of our practice. These procedures are minimally invasive. They're here for less than an hour. They're sitting up, and within a day or two, they're back to almost normal. And I don't think they completely understand that, although my staff does a wonderful job in prepping these patients, going over all the procedures with them ahead of time, going over things that are related to what you should expect pre, post procedure, what you should expect. Here's the number to call. The office staff always calls and checks up on them afterwards. I think they expected more from the procedure being a little bit more tough than it is. And then when they come in a couple of weeks and tell us that my headaches are gone, or I'm breathing better, or I'm not draining anymore, it's really very gratifying for them to be able to tell you that and provide this kind of service just in this little office that we have.